We know that at any moment he could have a seizure. You know, you don't know when it's going to happen.
If I don't take the medicine, I have a seizure.
I picked him up and I'm like, no, what's wrong? And next thing I know, eyes roll in the back of the head and he just collapses in my arms and he starts shaking.
The fear of leaving the house and going over to a friend's house was kind of fearful for me because I was afraid, you know, when would it happen? Where would it happen again?
But I ended up having a seizure in the hallway. And it was bad because then classes changed and everyone saw me having a seizure.
We didn't really know what the procedure was. We just tried to take care of the student that fell.
It's an awful feeling. It feels like someone just beat you over the head with a brick.
Living with epilepsy is impossible to describe. In some ways, it's like living with heart disease or diabetes or asthma.
It's another thing to think about something going wrong with the brain. There is such a mythology still associated, I think, with epilepsy. A stigma, if you would, associated with epilepsy, that you've lost control over what makes you that unique human individual.
So you can pull yourself up. Nowadays, I think it's becoming more common and wide known that it's a condition that can be controlled. And, you know, heart disease is treated with a certain medication. You know, diabetes is treated with medication. Well, epilepsy is treated with medication. It's just in your brain as opposed in your heart or, you know, in your bloodstream.
It's not mental illness. It's a physical ailment. Your brain isn't working right, just like your lungs don't work right with asthma.
There are more than 50 million people living with epilepsy worldwide, nearly 3 million in the U.S. In fact, 1 out of 10 people will have a seizure at some point in their life. 70% have no known cause, 30% do. People with epilepsy are in every walk of life. They cross your path every day. And for most people with epilepsy, the fact that they live with this condition is of little consequence.
99.9% of the time, your brain's fine. There's nothing wrong, okay? You can do anything you want to do.
But when a person with epilepsy does have a seizure, that's the time when others can help. This video will explain epilepsy and what you can do to assist a person having a seizure.
Some people call epilepsy or seizures a brainstorm, a storm in the brain. But what does that mean? Well, it means that this normal activity where the cells are signaling from one to the next is basically doing it in an uncontrolled way. So it keeps going and going and going. Depending where in the brain that activity happens, your seizure looks different. It could be a repetitive thought. It could be a vision. It could be a smell.
It can also be the classic thing that people tend to think of when they're thinking of seizures, and that's the tonic-clonic seizure, or what we used to call the grand mal. It can also be, on the other side of the coin, what we used to call petit mal, where all we're seeing is an absence of a person. They just go blank for a moment, stare off, maybe a little bit of movement. And so we have the huge range from the biggest, the strongest, the most worrisome for most people, the grand mal or the tonic-clonic, all the way down to a little bit of movement or simply staring.
Epilepsy is defined as recurring, unprovoked seizures. Seizures are caused by abnormal electrical discharges in the brain and are classified as either generalized or partial. Generalized seizures, such as tonic-clonic, are the result of abnormal electrical activity affecting the entire brain. Most of these seizures are obvious: a rapid loss of consciousness, falling to the ground, full body convulsions. Partial seizures, however, are more difficult to recognize. These seizures affect only part of the brain, and the symptoms depend on which area of the brain is affected. Simple partial seizures can cause a change in sensation or uncontrolled muscle movement, like twitching. Complex partial seizures result in a total loss of awareness, though the person actually remains conscious. They may stare, repeat physical motions, or act disturbed. Complex partial seizures can be difficult to recognize and can easily be confused with drug or alcohol abuse. How can a bystander help? First, let's look at the tonic-clonic seizure, where a person is unconscious and convulsing.
And so the first thing is that if someone is falling, to try to at least ease them down to the ground. If there's a small chance that the person may actually have a lot of drooling or may vomit, and so to put them on their side, and so that the liquid coming out of their mouth goes out of their mouth, drains, and doesn't go into their lungs, which would create another problem. It's important not to put anything in the patient's mouth, because of one of two things will happen. Either the person who is trying to put something in the patient's mouth is going to become injured, or similarly, if something such as a spoon or a pencil is put in the patient's mouth, it could potentially chip the patient's tooth or cause another type of an injury, and that also could potentially be swallowed, the object that's bitten off. If the patient is wearing something that's tight-fitting around their neck to try to loosen it, similarly, if the patient is near something dangerous, it's important either to move that dangerous object away or to move the patient into a safer place while this is happening.
And allow it to run its course. There is nothing that a person can do to change the course of that seizure.
A tonic-clonic seizure is usually not dangerous to the individual. However, in some situations, emergency medical services should be called so that the person can be assessed by professionals. Call 911 if any of these conditions apply. This is a first-time seizure. The person is injured or has badly bumped his or her head. The seizure happened in water. The convulsive portion of the seizure lasts longer than 5 minutes. A second seizure begins shortly after the first concludes. The person does not regain consciousness within 5 to 10 minutes, or the person has diabetes or is pregnant. On the other hand, calling EMS may not be necessary if the seizure lasted less than 5 minutes. You know the person has epilepsy, you know that this type of seizure is routine for them, and the person has suffered no injuries. How do you tell if a person has epilepsy if you don't personally know him or her? Oftentimes, the person may be wearing a bracelet, necklace, or watch that indicates the diagnosis.
When you know that someone has a seizure disorder and someone has a seizure in your presence, whether it's a generalized tonic-clonic seizure or a different type of a seizure, generally speaking, you do not need to call 911 or rescue services unless the seizure is going on for more than 5 minutes.
When calculating the 5 minutes, keep in mind there is always a period following the convulsion where the person is unconscious or extremely groggy. This is known as the postictal stage, and this time period is not included in the 5-minute calculation.
You may see somebody being very sleepy, really poorly, slowly responsive, and that would be described as the postictal stage. The seizure is over, and that's an important thing for people to understand, because the postictal period may go on for quite some time, for many minutes, even 15 minutes, 30 minutes. And in that time frame, that's not the seizure. So that doesn't mean, hello, the seizure is going on and you need to call medical services. You need to be there reorienting the individual, calming them, saying you know what happened and that they're going to be right back up and doing things shortly.
It's not something people need to freak out about, because chances are that person's had a lot of seizures before and they've bounced back every time.
Another common form of seizure, and one that is not nearly as obvious, is the complex partial seizure. Because only a small part of the brain is affected, a person may still be able to perform gross motor skills, like walking or sitting upright, yet be totally unaware of his or her actions.
There's no awareness at all. So, I'm a 30-year military veteran, so I'm used to responding to instructions. But once in a seizure, I don't hear you.
They may stare, mumble, repeat phrases, blink excessively, smack their lips, or pick at their clothing. However, they will be totally unresponsive to instructions because their consciousness is severely impaired.
In the situation of complex partial seizures, this is one of the times when people really frequently don't even know it's a seizure. And somebody might be staring and
Kevin, can you hear me? Can you hear me?
But somebody might say, I was looking at you and you looked like you were spaced out. Are you on drugs? That's the first question. Are you drunk? Are you on drugs?
And their consciousness is impaired. It's not lost. but they're clearly not processing language, and they're not processing your intention.
But a perception of being threatened will lead to somebody pushing away, hitting, fending off what, at least momentarily, as a reaction, is thought of a threatening move.
So that what you want to do is take harm out of their way, close the door. They will take the path of least resistance. So that I think the most that you would want to do is guide. You don't want to restrict them. You don't want to force them to sit down. That is the last thing you want to do.
A complex partial seizure can last from 1 to 5 minutes. When it's over, the person may be tired or may recover immediately. Emergency medical services do not need to be called if a person who is diagnosed with epilepsy experiences a complex partial seizure, unless they're not fully recovered within 30 minutes. There are 2 additional forms of seizures a bystander might witness: simple partial and absence. When a person has a simple partial seizure, their consciousness is not affected because the abnormal brain activity is occurring only in one specific area of the brain.
My arm is jerking. I can't stop it. It's not in my control. Brain that corresponds to that, the opposite side of the brain and the motor area of the brain, is making this happen, but it's uncontrolled, and that's a seizure.
Absence seizures, on the other hand, do affect consciousness and can easily be misinterpreted as daydreaming or ADHD in kids.
Were they just blank staring spells, maybe, with some eye blinks? But again, just a little thing. The complex partial, there's more confusion after it. The absence, right back.
And when a person has an absence seizure, it's like a switch going on and off, okay? They're with you one moment, they're gone for a few seconds, and they're right back with you, picking up right where they left off.
No special action is required if a person who is diagnosed with epilepsy experiences a simple partial or absence seizure. What can trigger a seizure? In people who are diagnosed with epilepsy, common triggers include interruption of anti-seizure medication, stress, hunger, sleep deprivation, and flashing lights. For people who are not diagnosed with epilepsy, there are many things that can trigger a seizure. In the case of a first-time seizure, always call 911. So epilepsy can come in many forms. On one end of the spectrum are extremely brief absence seizures that may occur multiple times a day. On the other end of the spectrum, tonic-clonic seizures that may occur only rarely, but when they do, can be quite disabling for the individual.
And epilepsy is not, it doesn't define us, and it doesn't stop us from doing anything.
A couple friends asked me if I wanted to go hiking 5 miles up 3,200 feet, and I was like, sure, why not?
Epilepsy, schmepilepsy. That's the way you should look at it.
I am not different than any other kid.
Don't have to treat them any differently. That's the main thing. You need to treat the person as any other person.
Don't start treating me differently. I'm just the same person with a minor addition.
For more information on seizure recognition, treatment, and epilepsy, visit epilepsyfoundation.org or call 1-800-332-1000.